Yeah. So there are many bioethical issues, right? The stem cells cloning, and then also end of life decision making. There are a specific term of it. I forgot. Probably some of you might know. I mean, when people can decide that they don't want to live longer. It's not for the young people, by the way, that whether someone out of frustration they can decide. There is, I don't know of a rule that they can decide, but only elderly people suffering from very chronic disease and of life, but still, whether they are allowed to go for it or not, those kind of ethical guidelines are discussed under CIOMS. And then, yeah, there are other controversies in relation to, the various bioethics issues. Uh, so planning your research, we have been mentioning about what are the issues to consider: study population, vulnerable population. If someone wants to do research with the prisoner, what are the vulnerabilities and then how to address them. Recruiting women during pregnancy because of their vulnerability and different, someone wants to do drug trial, there are limitation, and taking specimen of different types, swab sample and other things, there are sensitivities, so research ethics committee will not approve taking those kind of intervention for mentally ill people, because they are jeopardized in terms of giving informed consent, how to deal with this, those kind of population related vulnerability. And then there are issues to, uh, the justify when someone submit their proposal to ethics review committee. Physical risks, psychological harm could be possible because participating to a study, so that how the researcher investigator will address them, that has to be clearly explained. And the risk of any type should be minimal as possible, so that it does not substantially harm study participants. Social risk, economic risk that we have mentioned is possible by participating. So how to address them so that it's not affects negatively the participant, right? Research benefits. So benefits should be as much as possible out of a research. Benefits include like giving treatment, screening. Those are like the direct benefit. Indirect benefit also possible by direct benefit. I'm not sure. Giving incentive, it comes on the direct benefit, maybe, right? Monetary incentive or other incentive. So indirect benefit could be the societal benefit. The generating knowledge will be helpful not directly to them, but also in general, generating evidence, generating knowledge based on which the policy will be formulated. Uh, this policy will be, helping in general, right? So those are like the indirect benefit, and in many research, indirect benefit actually maybe not necessarily counted immediately, but it has broader implication. So this is something we need to refer in many of our research, that even though this research is not directly benefiting you as a participant, but the knowledge that we are generating will be useful for generating a treatment guideline or intervention for disease prevention, or change people's behavior in the society. So that is why it is important to participate. Those kind of motivation or those kind of things we can mention in research proposal, or even in the consent form briefly, right? The privacy confidentiality that we have maybe mentioned a bit. So it's very important to keep information that we collect in a way that are private. Private information should kept private. That comes under confidentiality. But during data collection, the maintaining privacy is also important. This is also true that if research involve sensitive issues, that if you don't ensure privacy, there are lack of trust, and then people don't want to open up and share the actual information. They then share something which is socially desirable, which is biased, right? So that is why maintaining privacy, ensuring them. So this is also important. Confidentiality is something, after collecting data, keep them confidential. And then one of the way is like keeping data in a um, safe under the safety net, so that nobody get access, those who are not allowed to. And then also unlinking or delinking personal information. If there is some personal information identifier, like the code or name or address where they live, those kind of information should not be shared in public. And then as much as possible, those information should be delinked with what we are trying to investigate in the research outcome and then other things. So personal information should be delinked. So whatever we are reporting is like a unlinked information. So nobody can be trust that, okay, this information coming from that individual, this information coming from that individual. So those kind of confidentiality and privacy issues must be maintained. Anonymity is also important, right? Oh, that's what just we have mentioned, de-identified or de-link. So there are some ways to maintain privacy: collect data in a private place, alternative location, practice anonymity when needed, safeguard data, mention explicitly that measure will be taken. So it need to be clearly stated so that people have confidence on the research initiative, and then the voluntary participation rates increase, and then they also share the authentic and true information. So informed consent actually should have certain elements. There are actually 8 um, issues that need to be there in the research informed consent. Mm, so at least 3 that has been here mentioned. The information means sufficient amount of information so that people know what kind of research is going on. Comprehension is not only giving information, but they need to understand them. Share in a way that these are in a lay language. These are, I mean, people understand them, not in a scientific jargon that has been mentioned when gives information. So people, okay, so that's why giving in a way that it is understandable. And then it is also recommended that the consent form and the questionnaire, if possible, do it in a local language so that people understand them better, especially in society and population. A certain group of people, they are not, they are less educated or uneducated, right? So volunteerism need to be there, right? So I mean, there is no coercion to participate, engage someone in research, right? It has to be through voluntary decision that whether someone wants to participate in a research or not. So as I said, there should be 8 elements should be in the informed consent. Mm, somewhere I should have these 8 elements. Okay, so another information like the risk. If there are any risk of participating in a research, that also should be mentioned. What kind of risk, physical, emotional, or other, that should be there. And other things, what kind of benefit the project can offer, those information briefly, whether there are any incentive will be given or any other benefits. So quickly that information should be there. And what other, like, so just remember that there should be, I was reading that 8 elements should be mentioned in a well constructed informed consent form, right? So I also see that there are 2 ways that people do informed consent. Like one is like the information sheet, they give information. Another one is just consent, which is a short form that the people take, either give signature or thumb impression for participation. But combining both information and consent in one form is also option in many universities, especially in the US. I saw that both everything is one form, so that people start from giving introduction to information, to compensation, to risk, to benefits, and then finally voluntary inviting them to give consent. So everything in one form. So this consent form, ideally a copy should be given to the participant, and then copy should be kept with the research team. Right. Participant inducement, what is it? So inducement is the motivation. So there must be some motivation. So motivation uh, is important to participate in a research project like the corona vaccine, that you see the COVID vaccine. So motivation is people are waiting for this because they know that after getting vaccine, mm, there are they can get prevented from new infection, right? And another motivation, like uh, in order to get rid of the doubt and confusion, the celebrities, politicians, they're taking, so they get confidence, right? So motivation should include. Uh,
Professor, in addition to that, I have heard that in Russia, they are giving, like, in order to take vaccines, they are providing like free ice creams.
oh, is it where? Where?
In Russia,
Oh,
Professor,
in
I got a,
Russia.
yeah.
Yes, free ice cream to
Hmm,
in order to
yes.
motivate. Yeah.
Yeah.
For giving vaccine to the children, I saw that there are various type of, the motivational things they do, giving
Yeah.
different gifts, smaller, yeah. So yeah, that's something I did not know, but is yeah, thanks that you have mentioned. So for research participation also, there are various type of motivational activity that research investigator can undertake. One of the direct inducement is like giving monetary incentive. So like 500 taka to enroll in a research, or 1000 rupee to participate in a research. So those kind of monetary inducement actually motivates people to participate. So especially having people in research, uh, developed country, not especially in US and Canada and European country, people don't want to participate. So it's a big deal to have people in research projects. So I saw that many research, they then uh, announce this kind of monetary compensation for the time that they spend. For example, if someone needs to spend 1 hour time, so that they calculate the how much they could earn for this during this 1 hour time, and then also they also add the transportation uh, cost and all this. So in order to motivate and the influence people to come and participate in the research, right? But of course, by doing so, there are some also debate whether this monetary incentive should be given or not, because that can also introduce some sort of selection bias as well, right? People, those who are in need of money, they will be more interested than those who are not in need of money, right? Especially, I saw that the young people, those who are student, they become interested if a research project offer $100 for participating or just giving a sample of certain type. So students, they are interested, young people, they are interested, but those who are at work, busy in doing full-time job, they probably are not much interested because they have full-time job, they are busy and all this, right? So they might, this kind of monetary offer also introduce some bias, of some selection bias as well, right? So that's why there are controversies. So yeah, giving, this is also disputed, but of course, both way it is in practice. Some project they still justified by saying that otherwise they are not going to get any sample. They don't fulfill their sample size, so they need it. Others saying that okay, even if you don't, so take some other ways like indirect benefit that uh, you will have by participating in a research project, promote that a lot so that people get motivated still to participate in a research project. So in order to monitor or in order to ensure that the research project that are being undertaken follows all these ethical guidelines and principles, there are institutional review board is a norm, and it has been suggested to every research go through this institutional review board so that they can review what has been proposed, and then if there are any suggestion, if they observe some sort of ethical the breach or violation, then they can suggest to correct, right? So institutional review board is something is there in almost every country of different types, under universities or under the research center, under the Ministry of Health. Maybe it is there. So, um, so we'll be discussing a bit about this institutional review board. So having an institutional review board was one of the recommendation comes under the CIOMS that has been is one of the slides just you have shown. Yeah, it was shown, right? So to have an institutional review board in order to safeguard this ethical standard. So what should be there in the IRB? There should be at least 5 members with various expertise related to. Okay, at least 5 members, right? One member have no affiliation with the institution, external member. One member primarily focus on the scientific issues. One member primarily focus on non-scientific issues like the, uh, the social ethics, for example, cultural issues. So it's not necessarily science, but social and cultural aspect. So I saw that in some research and ethics committee, they also involve a religious leader, so that whether there is any ethical issues from religious perspective. They also might have a representation from community activists to see cultural and then other, the societal issues that are being, especially the community-based project, right? Intervention projects. So at least 5 members of different background should be there, internal and external, right? But of course, most committee actually having more than 5 members, because for scientific issues, the scientific issues are again of different type, right? So biomedical science, social sciences. A committee actually might have multiple people from different scientific fields, so that the project that are based in different fields, they can assign to take care, right? So AOW, we also have an institution review, IRB ethical review board, ethical review committee. So so this committee is also, responsible to review that proposal, goes through the AOW. And then we have members from different discipline. But of course, there are limitations, right? Limitation in terms of even the faculty members understanding about these ethics issues. Not all faculty members come from, have this understanding. So there should be an internal, the orientation and training among the institution review board members themselves, because the which point to review for ethical perspective, and then how to come up with the recommendation, this understanding. There are various online courses that is also available in order to increase knowledge and understanding about these ethical issues. So as part of the committee is to orient the committee members appropriately so that they can pick up the right things at the right time, right? So what kind of document must be submitted to the IRB?
Professor,
Yes.
in the previous slide, so it means that there will be 5 members, and the rest 3, are these like the conditions that they are included among the 5 members or they are excluded?
No, the committee should have at least 5 members. And then 3 of the areas that has been mentioned here, one is like the uh, outsider, at least one, scientific issues and the non-scientific issues. There are three domain that has been mentioned here, three
Oh, okay,
domain,
okay,
right?
okay.
But
Like
maybe
criteria.
within one of
Okay.
this domain, you will have more than one. As I have mentioned, for scientific, you might have three.
Mm.
It makes it. So these three are the domain under which you can select participants. I mean members, right?
Yes, yes. Now
Yeah,
I understood.
yeah. So what are the documents? So most institutional review board actually have their own the checklist that what proposal should include when they submit, right? So they have a format that they suggest to follow, and then other supplementary material, including the consent form, the questionnaire, and then any other things that they need. There should be internal guidelines for the institutional review board, but of course they're a standard, right? So mostly the protocol itself, protocol maybe the full protocol. Sometimes they want a certain part of the protocol through a questionnaire. So I mean, they have a prescribed format might be. So for AOW case, we have a format. We have a format of a series of questions that we ask that could be taken from the original protocol, and then you can feed it in the format. So the original full protocol, it is not required, but you can have information from the protocol and then feed in the against the series of questions that are there. And then also the consent form, research study questionnaire should be part of the submission process as well. So the committee members, they review them and then give either approval or recommendation for modification, or sometimes they can even reject a research proposal, not giving any approval because of a certain risk that they think is not properly addressed in a proposal, right? So submission could be online submission or paper submission. There are various type of submissions. Mostly now the online submission getting more of a practice. Uh, like the online submission could be through email or even the the actual through submission through online. So for AOW, we started having an online portal so that, I mean, by clicking and then accessing to the form and everything, you can submit. But this process has also uh, deteriorated. I mean, the process has been disturbed a bit because of the change in the IT team. Previously, if you know, one lady, Jacqueline, was there. She was helping us designing this online, but now I don't know who is responsible. We don't have enough IT people to get engaged. So that's become an interruption. So what happens after submission of a research proposal to IRB? So there are three types of review that we can think of. Three types. One is like the exempt from ongoing review. So that no research should be conducted without going through the institutional review board, even if there is no full review required. So still it has to be listed within an organization. That should be the norm. But the thing is, sometimes it was not properly followed in some discipline. They think that they don't need ethical review because sometimes in the lab research they think that the human subjects are not directly involved. But and then also in social sciences, sometimes they think that it's not relating to health or anything, so they don't need to go through the ethical review board. But in fact, any research initiative should go through the ethical review board. If there is no I mean, particular risk, or if some investigator are not collecting information that are sensitive or nature, or not even involving human subject, but still they need to submit and then say that this is my protocol, but I don't need, I can get an exemption of review. So they can get an exemption, meaning that because the research are not, I mean, is doing, for example, doing a secondary data review, right? So it's not engaging human subject for interaction, for the interviews or anything. So it is possible to get an exemption, but everything has to be informed. I mean, go through the IRB. Then if they have enough evidence, they can get exemption, but it should go through, right? And then another review is like, it's called the expedited review. Like the review is, it doesn't involve the full review, full committee members. They are not involved in review. Only one member is given responsibility to quickly go through this and then approve, because the proposal only dealing with, for example, interviews and surveys and focus group discussion. It's not collecting any biological specimen. It's not involving any drug trial. It's not involving any vulnerable population like the people in prison or mentally retarded people or under 5 years of children population. So they are not vulnerable people. And then data collection through interview, survey, those kind of observation, right? So in that case, the review could be expedited. So they don't need to fill the full, with the full information. So they can get quick approval. So, but sometimes, I mean, another full review board is also needed for many research projects. As I said, that if especially research that involve uh, specimen collection, biomedical, the research, they need to go through them, drug trial, vaccine investigation, all these things, they need to go to the full review. And then approval will be finalized by full board giving their, the opinion and then review comments, right? So there are three levels that someone can, ask for approval. One is waiver, one is expedited review, one is the full review. But of course, there are guidelines that which kind of criteria need to be fulfilled in order to get exempt or expedited or full board review. Full board review, as you can imagine, when there are research, clinical trial, drug trial, or collecting biological material as a for investigation, or dealing with one of the sensitive study population, right? So will more than one IR be needed? Like, do you need just one committee to review, or there should be multiple committee, multiple place that you need to get an approval from? So this is a question. Yeah, Ashlyn, so you have a question?
Yeah, Professor, can you go back to the previous slide?
Previous slide, okay.
All right, so here it is told approval condition will be finalized by voting, right? So can you explain a bit about that? How voting?
Voting is among the review committee members, right? For approval, for giving approval to the full review board, they need to convene, they need to meet, and then also discuss about the proposals that need to go through the full review, and then they through voting they need to that there has to be a kind of a the consensus to approve a proposal. So if there are any dispute, that dispute need to be resolved in order to give an approval. That's what it means.
Okay.
Voting from voting of the review committee members, whether they are anonymously approve the proposal or not, right?
All right, all right.
Yeah. So will there more than one IRB needed? Sometimes it is needed to have more than one IRB. So there is also someone, I can see another hand.
No, Professor, you asked the question that is there more than one approval needed? So I was trying to answer.
Yeah. So what do you think? More than one needed or no?
I think, Professor, it depends on the type of proposal we are writing. So if the proposal is, related to many communities, so it should be reviewed by those all communities. And it is only related to one community, so um, it is enough. It is just, I think, I don't know, Professor.
Oh yeah, okay. So
I
let
think
me
it depends on
clarify.
the type.
Yeah. So institutional review board is a board that where as a researcher we submit our proposal for approval, right? Or have comments. So more than one is needed if a study is multinational, right? For example, a study being conducted in multiple country. So what happens is you need to get approval from each of these countries. So multi-country studies need approval from multiple local IRB, right? So in that case, more than one is needed. And for example, some students, like if you are doing your research in your own country, and then you have developed a proposal as a student at AUW, so AUW IRB also reviews your proposal, and then sometimes you are also required to get local approval from the Ministry of Health in Bhutan, Ministry of Health in Afghanistan. It depends on the type of the protocol, and then the regulation, rules and regulation these countries are having. So I saw that many students especially in Bhutan, they needed the local IRB to get an approval from their country as well. So yeah, multiple IRB is possible, and it is needed in some situations. Especially one of the example is like if the multiple country are involved, so they need even within the country, if like multi institution are involved. So sometimes several institutions has their own IRB, so they prefer to have it reviewed by multiple IRB. So within a country, this is also possible to have multiple IRB, especially in the big countries like US. So IRB is a very common practice for research projects. So every university, there are thousands of universities. So professors, researchers involved in multiple university, uh, so they need to get approval from their own university. So this is common in some occasion. Review of research on an ongoing basis. So it's not like it is actually should be done, that it's not like one-time approval that IRB has given. So there should be some sort of monitoring that every if it is multi-year proposal, so every year they give updates to the IRB, and then sometimes a renewal is also needed. Like they give only approval for 1 year, so after 1 year they come back and say that how it is going. If it is going okay, so they need to give a little updates, and then they also renew for the next year, for the second year. So this continuous review is possible under IRB. Okay, amendment is also needed. Like sometimes IRB approve a proposal, but when they implement in the field, there might be change in some issues. So amendment is also possible. They can ask for amendment that we proposed initially this, but there should be some change that we need to give a modification and updates, right? So this is also part of the IRB activity, to give amendments if needed by the researcher. Social harm.
So, Professor, if there
Mhm.
is any modification in between the research, do they need to give it to the IRB again and they have to start from the initial step and approve it?
It's not the initial step. They can just update that the proposal was given approval based, now a measure, I mean, amendments should be given to something that is substantial. Like, for
Oh,
example, uh, in some, for example, data collection method, you initially thought that you are going to collect data through observation, but now you need to do certain other method, like interviews, or sometimes you thought that you will be collecting the blood specimen for an investigation, but blood specimen collection becomes difficult or not relevant when it comes to the implementation. You are collecting another type of specimen, urine specimen, for example. So those kind of changes you can inform IRB. It's not like the starting from the beginning just to inform, and then they will give an they uh, are given an approval based on the just to adopt this change, right? It's not like the
oh,
starting over.
okay, okay.
Yeah. So social harm. So during the implementation process of a project, if there are any social issue that creates because of the study implementation, so those kind of either the issues should also be informed. Investigators should also inform this to the ethical review committee. Uh, any adverse event, social harm that are being occurred because during implementation, IRB should also be informed about them, right? So uh, yeah, so it's not like the one time that they give approval and then there is no monitoring or connection to the project. So it's not the case. So IRB should be informed of any major changes, whether it is change in the protocol or is any implication that are happening in the community because of this project implementation, right? Protocol deviation. So a protocol deviation is when an investigator make changes in the research, does something not approved, not described before. So if there is any major change that are I mean need to be done in the proposal protocol during implementation, all these things should be informed to the IRB, right? Yeah. End of data collection. Okay, so these are some of the steps that IRB actually should follow a well functioning IRB. But the thing is, the IRB does not function properly in most setting. They are sometimes they do just routine work to give an approval, but in terms of this monitoring and then also the subsequent following up of different issues, those kind of work sometimes are not properly done in many setting because one of the reason is like for many institution IRB is also run on a voluntary basis. There is no like a permanent setup, but in many universities, big universities, they have permanent setup. They have a secretariat, they have a coordinator of institution review board and an office that where they have multiple staff that they take care of all the different files and all the different protocols coming in, and then they maintain the correspondence appropriately. So this is like the well functioning IRB. There is a group of support staff. They collaborate with the committee members and give them the notice of the meetings, and then maintaining the meeting minutes and everything. But like for example, the AOW, I mean, we have some, everything is very small or non-existent or virtually existed, right? So for IRB is there under Research and Ethics Committee, but there is no support system, nothing. It's like the few faculty maybe take part as a volunteer, as a committee member, and then all the following up, all the monitoring process is absent because of limited resource. But this is for some cases, but for many university, many research center, IRB runs under a permanent structure in terms of manpower, human resource, or with all the logistic support, the internet connection, computer support, and then photocopy, printer, all these things, right? So, but yeah. So these are some of the steps that comes under the institutional review board, and then they are functioning, right? And training is also important. As I said, that not only the faculty member and then review committee members, they might have a different level of understanding. So there are various type of training is also possible in order to upgrade them about the human subject research, and then what are the issues should be considered as a ethical issues, right? So some of this training site that has been mentioned here, one of them called the CT training. I took this training. Someone can take this training online, and then if you pass, they can give you a certificate. So here is the link about the city collaborative institutional training initiative. They offer this IRB related or ethical review process related or human subject vulnerability related module. So you read them, go through them, give them the response of the series of questions. So if you score enough, so at the end you can get certificate. So this is the website. You can try to take one of these. Uh, so for many a number of research grant, if you want to apply there, so one of the requirements for them that whether you have completed one of these human subject training course, online courses, and then they even require that you submit your completion certificate along with the application for funding. So they require the investigator to submit that they have uh, earned this online or even on-site training certificate. So they consider this as a requirements because they think that the investigator are concerned or knowledge is enough on this human subject vulnerability and ethics issues. So these are all done in order to the minimize the risk and vulnerabilities, and then follow the ethical standard and guideline that was violated a lot, that we have mentioned in last lecture, right? During Nuremberg time, during other adverse event that has been happened, this has happened, right? So global research landscape, and then also IRB. So for many international research that has been done, multi-country research, research initiated in one country being implemented in other countries. So this kind of situation needs different, the ethical perspective to consider, right? So people planning a research project sitting in an university in Baltimore or Boston or in Canada. So they want to do something in South Asia or Africa. So there are, in addition, there are various kind of, yeah, so this is becoming a phenomenon right now, right? So international research, multi-country research, global health research. So there are also additional ethical issues that also evolved, like uh, the exploitation issues that we have mentioned, that the poor population and uneducated population in Africa, research done with them, contraception, different kind of treatment, vaccine. So what kind of exploitation? And then also sometimes research done not taking appropriate consideration of local cultural, uh, the practices, because people sitting here, they don't know about this local and cultural practices and standard, right? So it's it is possible to violate them, but that's why this research conducting in international setting, it's come up with a uh, another type of the criteria involving the local collaborator in a research, you must have someone from the local as an investigator so that they can give you information and feedback about these local standards and guidelines and all this. And then that's why the IRB is not only the university IRB is needed, but also local ethical review committee approval is also needed, which is locally grown, locally uh, functional, right? So local ethics review is also needed. Like project initiated by Johns Hopkins University conducted in Ethiopia, right? So it is needed that the project is also approved by an ethical review committee in Ethiopia, right? So because but there are also many challenges, right? Challenges is that those countries, they don't have any infrastructure, maybe they don't have the 5 different type of committee members. So those committee members may not be, I mean, it's not well functioning IRB that you can see always in the local level, right? So even their capacity need to be upgraded, and all these kind of challenges are there. So to take the local ethical review approval, this is a good idea, but capacity is an issue there to review properly, and then also coming up with different kind of specialty or subspecialty that are needed, right? Okay, current issues and future direction. Bioethics is an issue that comes under, um, in addition to the rights and ethics issue, there are specific ones that also evolve, creating ethical controversy in research. So bioethics is another field of ethics which deals with life and then also the biological um, different kind of issues, the microorganisms or human life or different, the bioethics is a part of overall research ethics, and then it also gets the bioethics in itself becoming in a discipline, right? So because there are a lot of controversial issues that are there in order to guide which way it should go, right? So some of the bioethical issues that has been mentioned here in this slide, the rights of abortion is considered in a different uh, in a different scale in different country and different society. So there are debates whether this should be allowed at what stages of gestation, all these kind of things. This is an area of debate, right? Surrogacy, allocation of scarce healthcare resources, organ donation, whether it should be allowed or not, healthcare rationing. Healthcare rationing is what, like mm, what kind of services should be given free versus with fee, and then whether they should be, specialized services should be available at what level, those kind of stem cell research, cloning, right to refuse medical care for religious and cultural reasons, even the vaccine. Some groups are now against vaccination, right? Whether they should be given a mandatory order that everyone must take vaccine, or it should be relying on this voluntary uh, choice that whether they should take vaccine or not, right? Sometimes the state has responsibility to ensure their population, then they can give an the universal direction that everyone must follow whatever the states want them to follow. So there are controversies or debates about them. So in order to address them, so bioethics becoming a important field in ethics. So, okay, Isandar, you mentioned that you are disconnected. Nusrat Right, Fatima, your network is unstable. You always have unstable network.
Yes, professor. Yes, professor. Today is very much unstable.
Today is much unstable. We try to be connected as much as possible, right? So Khadija has mentioned what is cloning. So can someone explain what is cloning?
Yeah. So cloning, it's like when we
Amal,
produce,
yeah.
uh, yeah, it's when we produce like individuals from the same cell. Like for example, stem cells. Like when we, it will be replicated and it produce the same kind of cells. That's how we do cloning. It will be a kind of what um, like many
Copying, it means,
Copying,
the
Copying.
same.
right?
Yeah.
In
them
brief, right?
together.
Taking on genetic characteristics is copying. Cloning is copying.
There is a
Clone.
movie as well, Professor.
There is a movie, right? Yeah.
Yeah.
So the cloning is like copying. So if you remember, there is the Dolly was one of the sheep has been cloned successfully.
Yes,
Uh,
yes.
so, but this cloning research has been given a pause. Otherwise, it could be progressed in a way that they can kind of start cloning many things, including human being. There is a movie that Janab has mentioned, right? So it will
Yes.
create a chaotic situation in our civilization. So, so there are controversies, there are debates. So that should be handled. That's why the bioethics becomes a new agenda, new area where ethics also dealing very specific biological issues, right?
Yes, Professor.
Yeah, so I'm sure that when you continue your higher education, bioethics, you will see that you might take a course on bioethics as well to learn more about it. Okay. Okay, so I think we are going to use of internet in research, another issue. Uh, the many research now being done using internet platform, even asking questions of different kinds, sensitive questions, and then also the privacy, confidentiality, whether it is possible to maintain there is also area where a lot of, the discussion should be done, whether confidentiality is possible at all, because nowadays internet through the internet research is being done is good, but whether the maintaining the privacy and confidentiality, this is one of the mandate of uh, the ethics issues. I mean, so whether it is possible or whether it is being maintained or not, so those kind of things needs further discussion, because research using internet will be more common, will be more popular, feasible, because everything, I mean, some of this physical activity is being on halt because of this pandemic, and then also maybe some other, the issues also come, so that internet will be an ultimate choice, but how to then address this privacy confidentiality, right? So those things should be clarified, discussed, and then also ensured in times to come, right? So these are in brief some of the issues that are important in terms of ethics, research ethics, right? But of course, research ethics in itself it is possible to has a full course, even multiple course. So in even with one of the branch of public health or even biomedical health is like research ethics is an unit, so people can be specialized in it, so that they can run IRB, they can guide IRB in research institute. One can be specialized in just by doing this, right? And then there is also job prospect. So IRB coordinator, IRB, because especially the developed country, the big university, they have a special unit to deal with the IRB. So IRB coordinator, IRB unit head, those kind of positions are also possible, right, to take as a career. I think with this, I'm going to stop this session. And then let's see the time wise, where are we? So yeah, we have time. But as I said,
30 minutes,
yeah,
Professor.
that's true. Thank you. Uh,
Welcome.
yeah. So I'm going to share one information. I mean, the research topic that I have mentioned. So I'm going to share the whole, this document with you. As I just have mentioned, that you are going to select a topic that you are developing your research proposal on. So just to give some idea or hints, but not necessarily these are exhausted list. There are many other issues that are not covered here, but it is possible to conduct a research on. So public health research topics. So research could be done on any of the communicable or infectious diseases, right? The COVID, tuberculosis, malaria, HIV/AIDS, diarrheal disease, dengue, malaria, but of course many others that you know of, right? It's possible to conduct research. So non-communicable diseases, heart disease, diabetes, cancer, hypertension, and the mental health, of course, is a big area, right? So it is possible to think about a research on non-communicable disease. And then there are also risk factor of diseases, alcohol, smoking, obesity. These are some of the known risk factor of many non-communicable disease, especially. So it is possible to conduct research on any of these risk factor on a population. You want to see the obesity issues um, among school children, obesity among men, women, whatever, right? Smoking. You want to see the level of smoking, what are the rules and regulation, all this alcohol consumption. So it is possible to conduct something on the risk factor. Environmental and occupational issues are also important, right? Air pollution and health effect, noise and health effect, traffic police, and then their health risk, garments worker, and then their healthy construction worker, roadside vendor, people sell the commodities sitting roadside, what kind of risk factors or risk that they are taking, whether they're practicing prevention or not. So it is possible, right? Health system research, hospital acquired infection, and then their risk, quality of care, patient satisfaction. Quality of care means, like, the hospital and healthcare center, they should maintain a certain level of quality, right? So are they maintaining them? And then what the people can think about this quality. So there are ways to collect information, exit interview or observation. There are checklists available, so it is possible to do that. Inequality and disparity measurement, inequality in terms of health outcome, inequality in terms of um, uh, availability of the healthcare services for various population. So measurement of inequality is also possible. If you remember, in not in okay, in previous one course that we have mentioned, absolute inequality, and then also absolute, and another one is what, relative inequality. It is possible to even measure inequality, right? The cross-cutting issues, mother and maternal and child health, nutrition deficiency, vitamin A, iodine, and all these things. It is possible to understand the stunting, wasting in a population, right? And what are the risk factors that are there. Dietary practices is also possible. The dietary practices, like whether the people take the healthy diets or not, whether they're taking enough mix of the carbohydrate, and then other macro and micro mix, right? Micronutrient mix. Child feeding practices and growth, breastfeeding, child feeding, and then growth monitoring of children. Yeah, migration and refugee health is also very important, right? Working on migration, refugee, population density, family planning, contraception use, adolescent fertility, fertility trend, child marriage and teenage pregnancy possible, road traffic accident, aging population, something to do with the older people, their risk factor, their lifestyle, quality of life, those kind of things. Health and social effect of electronic device uses, social networking, and then what kind of impact they might have because of excessive engagement with device and children, their cognitive function, academic progression, all these things, it is possible, right? Drowning, snake bite, autism, physical disability, population coverage, children under 5 years, women during pregnancy, adolescent boys and girls, student, workers in any sector. Location, you can conduct your research in community, rural, urban, school, university, hospital, clinic. You see the research project, okay, so you can do something to understand the prevalence and incidence. You can do something to understand the risk factor and determinants, trying to understand knowledge, attitude, practice. So these are some of the type of research that you want to do. So these are in brief, but of course there are other issues that are not covered in this list. So it is possible to think about a topic that you are interested in. So as I mentioned in the initial discussion, that research interest is based on personal choice and preferences, something that has happened in the family, or you are interested because you have taken a particular course or had an interesting discussion with someone, or anything that triggers someone to conduct something, deciding about something. So this document, this file, I'm going to share with you all, so you can think about a research idea that you want to conduct, you want to develop your research proposal. Okay, so I can see what, like, so Tazri has mentioned here the term cloning. Oh, Tazri has given explanation of the cloning. It's a copy. The different process that can be used to produce genetically identified copies of a biological entity. Thanks, Tasri. Yeah. So, just to think about a research topic that you want to take for developing a research proposal, right? But of course, I can help you if you have the multiple idea. It is also possible that you can discuss with me, and then also our TS. Uh, yeah, they can also be helpful.
Professor,
Yeah,
for this course, we have to write a research paper.
we have to write a research paper, research proposal.
Oh, proposal. Okay, okay.
You have to develop a
Paper,
research
paper.
proposal. If you remember the research proposal, different steps that I have mentioned,
Yes, yes, yes.
you have
So
to
just
follow
a
them
proposal.
and
We
then
don't
write
need
a
to
research
write a research.
proposal for yourself. And then,
We don't.
yeah,
Sorry, we don't have to write a research paper after
I don't know
proposal.
what does research paper means actually.
Uh, I mean, like, usually in the writing seminars we wrote a research paper.
So what is it about? I mean, research paper includes what are the
I
the
mean,
section or subsection that research paper has.
yeah, yeah. So the paper that we have wrote in the writing seminar, it's like it's not uh, quantitative, but it's kind of like a qualitative based, like based on text. We read text, and then from there we developed a hypothesis, and then that there in I also that time also I wrote a research proposal before proceeding with the research paper itself. So it's like, mm, you know uh then he approved whether I can go on with the research or not. So then after that, after approving of the research proposal, then uh like then started with the research paper, like introduction, literature review, then the methodology and everything.
Okay, yeah. So for this course, you are going to write a research proposal. You are going to develop a research proposal. So I'm not sure whether it is called research paper or whatever. You are going to write a proposal, research proposal, and then what should be included in your research proposal. So we can discuss, but of course, if you refer to my previous, the PowerPoint slide, you will have an
Yes,
idea that what are the steps that should be included in your research proposal, right? So you will be writing a
Ah,
research proposal.
so professor, for the midterm, so it will be counting as a midterm or midterm exam or
So research proposal is writing a research proposal is an assignment for throughout the semester. So it's not like I'm going to give you the write a research proposal full in one step. So for example, the topic that I am sharing, so you will have a chance to select one of the topics that you want to do, and then you ultimately go through the steps. So I will give you okay, let's stop here. And
so so professor, for the research proposal, do we need to select the topic from the given topics that you have?
so for writing a research proposal, what you have to do first, you will select a topic, and then we'll go step by step. So these are some of the steps that you need to follow, like finalize the research topic, and then finalize the study design that you are going to follow, study population, what kind of people that you are focusing your research proposal, and then which site, is it rural, urban, in the community that you live, or where. uh, that is one step, and another step is like to conduct a literature review, writing introduction along with research question, hypothesis, aim, objective, logical framework, that if you remember that we have discussed. This is one step. So for each of this step, we'll have a timeline, deadline. And then that is not, and that will be for the whole semester, right? So for example, the first one, finalizing the research topic, study design, deciding about the study population and study site. You will be, you need to do this, and then we can decide about the date that when you think you can think about this thing, topic and design and then population and then site. These are basically decision and then choice that you want to make, and it's not much work, but most of them are kind of a more thinking and reviewing and thinking, right? So when you think about this and decide, the next step is to start doing the literature review and then writing an intro part, like research question, hypothesis, aim, subjective and logical. So we'll set another deadline for this. And then also the writing the method section is another deadline. And then also the presentation. So these four time that we are going to set, and the presentation of course would be um, just in the final week or before the final weeks, somewhere at the end of the semester. But other three sections will be in between. We'll give at least 3 weeks time for each of this section to complete, right? Three weeks time, right?
What about the topic, Professor? Isn't it the time to start?
Topic, I'm going to share the word file that I shared with you before. You will have a chance to think about a topic. You have to come up with your own topic. Think about a topic, choose one. But if you have multiple, if you need clarification, if you need help, of course, we can communicate, and then you can decide about one that you want to do, right? So when you write this proposal, think about your senior thesis. If you want to do a senior thesis, for example, choose something that you can actually push it as your senior thesis, so that you don't have to develop another one, right? So this proposal that you are going to write, you can use this as your senior thesis project if you plan to do your senior thesis, right? Okay. So is there any questions or anything about it? Okay, so as I said, like my word is giving a problem. So probably I don't know if I can write here. For each of these steps to complete finalization of topic and design and population and site, uh, when do you think that we can do it? If I share the public health research topic, all the things that I have just mentioned about chronic non-communicable disease versus communicable disease versus population. So this sheet I'm going to share with you. So by reading them and then also thinking about your topic, you can propose a research topic. So maybe today, by next week, you can come up with a topic that you want to develop your research proposal, right? By next week.
So professor, so for each of these, we will have a, uh, what is called, instructions for each of these, right?
Yes, instructions. That's true.
Okay.
Yeah.
Professor, will you share the book also with us, the research book, which we have already, the 3 chapters?
Yeah, I already shared the subsequent chapters I'm going to share with you. Okay.
Okay, thank you.
Yeah.
Yes.
Yeah. So maybe sometimes by next week, you will propose a research topic that you want to do your proposal on, right? Everyone, you need to select a research topic. So by end of this class today, I'm going to share all different kind of topic that is possible. So by going through it and then also from your own thinking, discussing with friends, discussing with whoever, you can come up with a topic by next week, the topic that you want to develop your research proposal on. And then just think that your proposal that you are going to develop, you can use them for your senior thesis if you want to conduct your senior thesis, right? So another thing that we are going to introduce.
Professor, this will be individual, right? The
Individual,
research proposal?
yeah, this will be an individual project,
Okay,
right?
Professor.
The writing a research proposal will be an individual project. Each one of you will be writing, and then yeah, so like you cannot do it since it is not a group project, and then it is possible that same topic could be selected by multiple of you, but I will know at some point that whether the topics are overlapping or not. So uh, if it is not, if it is completely overlapping, that I will let you know. But it is possible to have the same topic that you conduct a research in Pakistan and Afghanistan and then in Bhutan, same topic. This is possible, right? Because you will be doing in a different population. So then it's not a problem. But like for example, in Bangladesh, if you are doing the same thing in city of Chittagong, on the same population, same disease, in the same city, if it is the case, then I will let you know that there are overlaps. So you can think one of you could change the topic to something else, right?
Professor, will you share the topics or we need to choose all by ourselves?
I am going to share all the topics that I have shared, and then you need to choose one for you, right?
Okay, Professor, got it.
Yeah. Okay, so how many minutes left? We have still some time.
Professor, are we supposed to choose only from those topics which you are sharing, or no, we
No,
can?
this is just an example. So you can choose anything. You can choose any other health topics, any other topics that you think you are interested in. It's like the one that I'm going to share, or the one that just I shared is just to give you an idea. But you can choose even outside of it. Yeah.
Professor,
Uh-huh.
all the for example, if I choose a topic, should it be related to the health or no? I can choose like social issues as well.
Can you give an example? What kind of social issues that you want to choose, or you can choose?
Professor, I don't have in my mind right now, so I
Yeah.
just asked that.
So you are hypothetically thinking, hypothesizing, right? So no, this is a public health class. Public health. You are a public health student as well. So the social issues are linked with health issues. So it is possible that you are cross-cutting a social issue, but there must be a health issue that are relating to the social issues. Like for example, if someone wants to do how to help people come out of poverty, you want to do a microfinancing. So, and then if you are not thinking about health issues, so probably those kind of things are not possible. So if you are helping people, giving incentives so that the poor people can be out of the poverty. So this is more of a economics issue. So I think this is not, I mean, encouraged. So you have to have a health issue, and then of course a social issue could be linked, right? You can deal with stigma of menstruation or stigma of genital mutilation, because genital mutilation, menstruation are very much a health issue, but of course there are social issues as well. Health is the priority. Health must be there, but it could be social issue or biological issue or anything. But health is must be the central, right? Yeah.
Yes. Professor, can you can you send that today's recording because I got disconnected initially.
Yeah, I'll share definitely.
Yeah, I
Okay.
missed the first 40 minutes even. I
Oh,
don't know
okay.
what happened to my room, my Zoom professor. I'm joining the other classes, but while I'm joining your class,
Yeah.
it's always uh,
Yeah, I
there is some
know.
problem.
It's not. Okay, I'm going to share with the slide. Sure. So our next topic that we are going
Recording.
to discuss is like sample size and power calculation. So I think we can just introduce this, but not going to discuss today a lot because of the time, right? So as I said, when you conduct a research, and then if it is a quantitative research, for example, having an appropriate sample size is important. And then this sample size, that how many people that you are going to include in your research, is not an arbitrary thing that you can see. You can say in your proposal that I am going to interview 175 people. So this is not an arbitrary decision that as a researcher we can make. And then this sample size, that how many, it should be based on a scientific methodological approach. So that's what the sample size calculation and the power calculation comes in. So the number that we are going to deal with from a population is based on different criteria and characteristics. So what are the characteristics? How do we decide this? So this is something will be focused from this presentation, right? And then these are particularly true when someone wants to do a quantitative research. If you remember that we discussed with the qualitative research, which is more an in-depth and focus group. So for those in-depth and focus group based research, so probably you don't need to calculate sample size. But if you want to do a cross-sectional study, if you want to do a cohort study, if you want to do a case control study, or if you want to conduct a randomized control trial, so then the sample size calculation is needed. And then how you are going to do it? So we are going to discuss why it is important, and then what are the steps that are needed in order to calculate sample size. So, okay, so let's see. Yeah. So why do we need to calculate sample size? Why it is important? Sample size calculation is important because the number that you are going to include in a research study could be too small that it may fail to detect the important effects or association. So with the small, very small sample, like 50 or 80 sample, so even there are association, so those association remains statistically insignificant because the sample size is too small. So that's why you need to calculate sample size, or sample size could be too large. If someone is so enthusiastic of conducting research, they can think, okay, I'm going to interview 6,500 people. So 6,500 may be a little too large. So if it is too large, so it takes a lot of time to conduct a research, or it could be costly that you need to travel different part of a community, or you need multiple people to engage to complete 6,000 interviews. So too many sample is also a problem because it could be difficult, inconvenient, costly, and then unnecessary, right? But if it is too small, then it is also a problem because then when you use one of the statistical software, then the findings that you are going to get will not be statistically significant because the sample size is too small. That's why you need an appropriate sample size which is optimal, right? You need an optimal sample size which is not too small, which is not too large, and then which is not based on just a individual perception. Rather, it is based on certain criteria that are recommended for calculating sample size. That's why sample size calculation is important, right? The when to do a sample size calculation. Sample size calculation should be done at the beginning of the study proposal writing, at the start of the proposal writing. So sample size calculation is part of the process when someone writes a research proposal. It's not like when you go to the field or before data analysis. It's not the case. It's you are writing, calculating the sample size when you are writing a research proposal, because in the research proposal you are going to introduce the topic, you are going to introduce whether this topic is how prevalent, how big is the problem in the society or the community. So based on these characteristics, you are going to calculate the sample size. So it's like sample size calculation is part of writing a research proposal. So it's like at the design stage, you need to do this sample size calculation. It's not during data collection or just before the data analysis, right? So, I'm not going to get to these details. We are going to cover this in the next lecture, next class. So just to introduce that, next topic will be on the research, the sample size calculation. And then I'm going to share this slide right away after the class, along with the list of the topics, research topic that I have mentioned, right? So you can go through them so that it can help you decide about the topic that you are going to write a research proposal. So research proposal write-up, you will select a topic that you want to develop a proposal, and then think about a senior thesis, that if you continue doing a senior thesis, the same proposal that you can use that you are working right now. So that's a kind of a sequence or chronology that I followed for the students last year also, or the year before, that they develop a research proposal during this course, and then they use them for the senior thesis when it comes to conduct their senior thesis, right? So is there any quick question before Chetan can take attendance?
Professor, can we do it group wise also?
No,
Or
it's
no,
not a
this
group,
is
it's
in
individual. This is separate individual proposal. Because senior thesis you cannot do as a group. Okay, so at least for now. So this one is an individual assignment. Okay, I think with this I'm going to end, and then Chetan.
Yes, Professor. Can I take the attendance now?
Yeah, please go ahead and then take that. And